Hello, welcome to iCare. This is Dr. Rahul. Last time we discussed what is geriatrics, who is a geriatrician, and what do they do differently. This time we're going to be speaking about the geriatric patient, the older person. Now, how is a geriatric patient? How is an older person different from a younger person or a routine adult patient? Well, if you've been fortunate enough to look after an older person, maybe it is your parent, maybe it is your grandparent, you might have seen sometimes that, during a course of illness or prior to the onset of the illness, they start behaving very oddly. They are suddenly either, very quiet, very tired, in bed all the time, not very interactive, and maybe disoriented, not able to understand who the family members are around them. Maybe they're not eating properly. Or else, on the other side of the spectrum, you might find somebody to be very agitated, very abusive, even sometimes, speaking in a very offensive manner, something that this person is not used to be, behaving like. Well, that is what we call delirium. Delirium is something that we're going to be discussing throughout this channel in multiple videos because it's something very important and it's a talk in itself. It's a topic to be understood in isolation itself. So we started off this topic with how an older person presents differently when compared to a younger person. Now let us take the example of pneumonia maybe. A younger adult presents often with very textbook presentation symptoms like a high-grade fever, difficulty to breathe, cough with or without sputum, fast breathing, etc. etc. But an older person need not present with anything of these. Now, do you know that an older person need not always have fever as a presenting symptom? Most often, for a younger person, it is this fever that takes him to the doctor. Fever with or without cough, but generally that is one of the most primary symptoms for which he takes medical attention. But an older person need not have fever. The mechanisms for fever are not as good in older people when compared to younger person. So you don't have your fever, your cough may or may not be there. The difficulty in breathing is not something that he might have communicated, either because he's got a memory issue or probably he's not perceived the difficulty in breathing. And the fast breathing is probably not something that the family would have understood. So what happens is that this elderly person has got a pneumonia, but you don't understand that something is off. There is a problem with him until say later on. Sometimes it may be a couple of days, sometimes a few hours. Now supposing it's a pneumonia or a urinary tract infection, even if you don't pick it up in the initial few hours, it may be fine. It is not catastrophic, generally. But imagine if it is a acute cardiac event, if it's a heart attack. Supposing it's a heart attack and you waste a few precious hours not able to understand that there is something problematic with him. Those may be the critical hours that differentiates between a successful intervention or a partially or even non-successful intervention. And this cardiac issue could end up being catastrophic. And that is just because we were not able to perceive how he presented in the initial few hours. So the next question is going to be, why is it so different for an older person when compared to a younger person? If you've seen, say, small children, 1 or 2 year old, who've had high fever, say 40 or 41 degrees Celsius, you might see that sometimes they behave in a very different manner. They behave very oddly. Some start singing, some speak in a disoriented manner. It is because their brain is not able to cope with this high temperatures. It is the same thing for an older person. In a small child, the brain is not developed enough to cope with this high fever. In an older person, the brain is shrinking. The brain is degenerating. The brain is getting smaller. The mechanisms are getting disrupted even more and more. And the brain is not able to cope with high temperature or high fever or symptoms like these. An inflammatory episode. Inflammatory episode means an infection, pneumonia, urinary tract infection, any disturbances as such. The brain is not able to cope with these stresses and starts behaving in an odd manner. So to sum it up, it is very important to understand the older persons behave, react and respond to diseases in a very different manner, in a very varied manner. You need not have the classical symptoms. You just need to keep your mind open to the possibilities of such different presentations. As a son, as a daughter, as a grandchild, you need to be aware that you need not have issues, then you need not have symptoms that are very classical for them to come up with, to which you respond. It could be a very subtle change that might sometimes require medical attention, evaluation, and if caught at the right time, could even make a huge difference in the outcomes, the eventual outcomes that disease has. Please stay tuned for more videos like this. If there is any topic, anything that you would like to know more about regarding an older person, please write to us. We have an email address in the description. Get in touch with us for your queries, your opinions. Thank you.